Do you feel safe to bring up transformational health systems ideas in your workplace? I'm Chad Swanson and I'm an emergency physician. I'm on a journey to understand and transform our health system. I ran across a LinkedIn article by Helen Bevan recently that discussed the psychological safety at work. I don't know Helen at all. I have no personal conflict of interest, though I have found her posts on social media to be very insightful regarding organizational change and strategy and systems change. She wrote that I really like this new article on psychological safety, that is, a belief that we can speak up, take risks, and make mistakes without fear of being judged, humiliated, or punished at work. There's an infographic here that describes when there isn't a culture of safety. People say that I don't want to appear negative. I don't want to look ignorant. I don't want to feel incompetent. And I don't want to seem intrusive. Helen then links to an article by by Christina Lai. And in this article, Christina shares that psychological safety can improve productivity and profitability, risk-taking and innovation, colleague and client relationships, talent development, risk management, employee well-being and retention, that's important, and organizational culture. So Christina says that if you want to create a more inclusive environment, don't shut people down. Thank them for being willing to share their thoughts. You may very well disagree with them in private, but doing so publicly does not serve anyone. She then shares a number of strategies. Now, I haven't tried any of these strategies, but I'll just mention them briefly. One is a strategy called Manual of Me, so encouraging team members to share working preferences they're comfortable with disclosing. A team charter, unifying the team on a vision and mission, outlining goals, values, and roles and behaviors. In team building, there's Lifeline. Each team member charts the highs and lows of that life that have shaped the person they are at work. Anxiety Party, and then there's a number of other ones. I'll provide a link to this article as well as Helen's LinkedIn post in my description of this video. As I think about it, there's two types of psychological safety. One is the psychological safety to speak up within the current system. And the second is to speak up for transformational change of that system. And I'd like to talk a little bit about the psychological safety of speaking up to transform the system. Let me just pause here to share a few thoughts that I've had recently. So as a reminder, this is a daily video that I'm planning on producing to discuss transformational change in our health system with a historical lens and a complex systems lens. So I think that there's going to be value in a regular cadence of sharing my thoughts. It forces me to organize my thoughts and to share them in a way that makes sense. And I hope that it's valuable for others as well. One thought that I've had recently is the importance of social connection for health. I'm reminded of evidence that demonstrated that strong social relationships, as I recall, have a positive impact on our health that's more powerful than stopping smoking 15 cigarettes a day. I've thought recently as well about medical education. So I think we need a transformation in medical education. For one, I think that there should be a required major for all pre-medical students in a new major related to transformational change in health systems. And second, I think that medical education should evolve to be competency-based. That is, a physician's assistant, for example, with a tremendous amount of experience could essentially test out of years of the required education and training, and that could result in financial as well as well-being positive effects in the health system. It could also result in a health system workforce that's more nimble, so professionals that are able to change jobs within the health system as needed as their own life experiences changes and desires change. The third thought that I've had is I think there's a physician at Johns Hopkins, I think his name is Marty McCary or something. He has a new book coming out that I'm excited about. So let me share the idea of psychological safety within the context of our health system. This is a graphic that I produced a few years ago with a colleague, and I'll provide a link to it in the description. But if you can imagine that this represents our health system, and there's a variety of different, we'll call them subsystems, these circles with different colors. One is healthcare, one is health policy, one is health education, one is the media, public health. And so each is relatively separated or fragmented from the other. Each is pointing in a different direction. For example, healthcare is pointed towards rescue care and volume. So as an emergency physician, I'm trained and incentivized to care for as many patients as possible and to focus on the emergency at hand. And while that seems to make a tremendous amount of sense from an emergency physician perspective, from a health system perspective, we don't want a lot of people to go to the emergency room. We'd like to keep people safe and prevent emergencies. And many, if not most, emergencies are actually a point of time or an episode within a journey that an individual is going through of health or well-being. So that's just one example of how each subsystem, each tribe, each organization, each profession is focused on short-term, limited goals without adequate consideration of the overall focus of the health system, which would be health and well-being for all of us at the lowest possible cost. So if you can think about the subsystem that you work in or that you exist in, so you might be a health professor, or you might be a researcher, or you might be a politician. You may have no specific or professional experience with the health system, but you work within the subsystem of a family or within your neighborhood or community. And so you can then think about what is measured within your subsystem, what is talked about the most, what is celebrated, what is incentivized either financially or otherwise. And the answer to those questions can give you a glimpse into where your subsystem is focused. And then the next consideration could be, are you free or are you safe to speak up and share ideas related to transforming the health system for health and well-being for all? For many, this might result in either personal anxiety or fear, but it also might result in jeopardizing their profession or their job. As an example, in health academics, it seems to me, and I have some limited, very limited experience with academics. So those of you that are professors, please feel free to critique my assessment. But within academics, there seems to be a significant emphasis on publications and grants. And so as researchers in health, scientific studies are published, often there's duplication, or often the studies don't have a methodology or an approach to the research that is as effective as it could be. And so we have a large number of studies that are often contradictory, and or don't have the methodology that's strong enough to answer the question with the certainty that we need as a society to answer our health questions. And so if that academic professional chooses to spend her time engaging with the community or empowering marginalized populations around the health and around education or research within their community, at the expense of grants or publications, then their job might be jeopardized. So that's just one example that I see in how the goals and focus of our subsystems can undermine the overall goal of our health system. So let me just scroll down to a different graphic here that represents an optimal health system. So here we see these subsystems again, though their boundaries are less well defined. So some of the subsystems are combined with other subsystems. Some are beginning to be combined. There's feedback loops between the subsystems, and they're all aligned or combined within a larger system with a shared vision and aligned incentives for health and well-being for all, equity, wellness, efficiency, satisfaction, population health, goals that we all want as a society. So I'd like your thoughts on psychological safety within your subsystem for transformational change in health. Thanks.